Hello. Welcome back to my channel. My name is Dora, and this is Dora Vlog. If you're new to my channel, you're highly welcome. If you're watching me from Facebook, please follow this channel. If you're watching on YouTube, please subscribe. The reason I ask you to follow me is that on this channel, I drop information that will help you to actualize that's your dream of migrating abroad. And what want to actually give more attention this period is those category of people that it seems as if they are less opportuned to travel out of the country, especially to Canada. Okay, so if you are one of those people who think that you don't have opportunity because you no go school, you know to go school, ndị ahụ eche na maka na fa agụrụ akwụkwọ ka nsọ ya n'Igbo, because some people say I should be speaking more Igbo. Those people that they think because they know to go school and think that they don't have opportunity to travel to Canada, okay, I want to actually dedicate more of my time, not that you're the only ones I'll be doing, but more of my time this period to bring us search for information for you people. So if you have your brothers, your friends, please don't be stingy. Call them and subscribe or follow me. Don't just send me friend requests. If you send me friend requests and I see you are not my follower, I will not accept. Follow me, okay? Yes, follow this. Just click the follow button to follow me. Now, in this video, I've talked about some other people in other videos. I've talked about truck drivers, opportunity for you to migrate to Canada as a truck driver, yes. The other day, I brought out information on who are those people again. I think, I can't remember. Just check one of my videos, okay? Can't even remember. Christmas, it will go my mind, all those activities. But today, all right, today I want to talk about those who work in the healthcare. Yes. So if you're one of those people who work in the healthcare or you know someone that works in the healthcare, please, this video will do you some good. It will give you information that even if you're not ready now, it will help you to start planning. You have a vision for yourself. All right. Yes. So I want to start by explaining to you different pathways people go to Canada so that you understand. Because the most popular way is going to Canada as students. Many people today hear this person has gone to Canada. Oh, it's as a student, you know. Yes, that's one of the pathways. There are three pathways people can go to Canada, migrate through to Canada. You have the first one, which is more popular, the Neja Agua, for those who go to study. That is one pathway. From after studying, you can then become, get a job, become a resident, and from there you become permanent, and from there you become citizen, right? But actually, it seems as if going to Canada to study, in the past now, it's easier, it makes it more you know, you see your path. It's easier because you just want to leave the country and you want to live in the next 6 months. You want to live in the next 8 months. Just okay, let me just get admission. In fact, in the next 6 months, get admission, process your visa, and off you go. That's fine. So, but this other one I want to bring your way today, it takes time. Now, the reason why I want to encourage people to start looking at that is because the study pathway seems to have been so overwhelmed. Or they can be mad at Caligozi. So the Canada is now making it more difficult for people to come through studies. They have raised the amount of money you need to show that you have and all that and all that. Okay. In the past, they won't ask you for your school fees receipts. That's why some people will come here and they'll start working and be paying their school fees. But right now, as I'm talking to you right now, the latest policy, the latest news from the airport is that you have to show your receipts. So you see that it's becoming more difficult for people. Many people are being sent back. When you go flights, you look in the airport, they will just send you back because and the school fees is not cheap at all. It's ranging from $10,000, you know, for diplomas and degree, first degree. The way you can get it cheap as maybe $5,000, and all that is if you're doing masters, and depends on the masters you're doing. So you see that going to Canada as a student is becoming more difficult, and that's why because I like to give people hope. That's just me. I like to give people hope. So I've decided to, open your eyes to this other opportunity. So if you are not following me on this channel yet and you're still looking at me, I wonder what you're waiting for. If you don't follow me, you can miss opportunity that will just drop. Okay, the other time I dropped a job vacancy for truck drivers. And if you're someone who has been following me, if you prepare yourself, such opportunity can come again, because all these opportunities, they have deadline. Now, quickly today, let me go straight to what I have to present to you today. Is about those who work in the health sector. And I want to tell you that everybody who works in the health sector is highly needed in Canada. Ndị niile na-alụ na health sector, na-alụ n'ụlọ ọgwụ. Ọ bụrụ na ime onye na-alụ n'ụlọ ọgwụ, ka m si etu a wee tinye, onye a na-alụ n'ụlọ ọgwụ, whether ma doctor, ma nurse, ma nurse Eliza. Those people they call quack nurse. Now we call them quack nurse somehow. They're not quack, you know what I mean? Yeah, those people we call nurse Eliza. Because they wear white, they work with the nurses. They are not registered nurses. Here they call them assistant nurse. They call them nurse aid. They are helping nurse. So if you have been trained in Nigeria and you're not a proper nurse, you didn't study nurse midwifery, so you are like, oh, had it been that I studied nursing, you heard that going to Canada as a nurse or going abroad as a nurse, you too, you can come. You are under the people they call the healthcare workers. So straight away, I'm going to lead you to a province that is actually in need of healthcare workers. So if you know you're someone, even if you work in the hospital and what you do in the hospital is to clean, to wash the hospital equipment, do this and all that, you too, you have worked in the hospital, you've had experience of healthcare environment, you too, you can start preparing yourself. So straight away, I want to introduce you to Saskatchewan. Saskatchewan is one of the provinces in Canada, and there's a way Canada, political geography is structured. So each province, they are somehow independent on their own. They're somehow autonomous. They can decide to publish, who they want at any particular time. So Saskatchewan right now is one of the provinces in Canada that has job shortage, shortage of workers in the healthcare sector. So, and they have opened up a new opportunity for people to migrate to Canada by March 2024. So you see, I am giving information you can plan ahead. All right. Yes, so they have all asked people to do what? To put up applications in the pool. They've asked people to open up, go and drop your application. You know how it works. It doesn't cost money for you to just open your profile, drop your profile there, and you go about your business. One day you can just get a message that you have been contacted. All right, so I'm going to just go straight to Saskatchewan portal and show you how it works. Okay, Saskatchewan is one of the provinces in Canada, and straight away we are going to immigrating to Canada as a healthcare. Voila, this is Saskatchewan International Healthcare Worker Pool. Voila. So healthcare worker, we say international means you are outside Canada, all right? And they want people to enter pool. Entering pool is you to submit your application, submit your resume, just submit your resume. This is interest. I'm interested in going to your country. This is what I have. This is what I'm doing. You submit it, package it, and submit it, and go about your way. By March 2024, you can get a message that you can now come and apply. All right. So let me read it for you. Move to Saskatchewan with the International Healthcare worker expression of interest. You're a healthcare worker, you want to express, I am interested. So all you have to do is to expect. So it says, if you're interested in working in Saskatchewan in the health sector and would like to be contacted about job opportunities relevant to your skill set by SINP or health employers, please create an expression of interest profile. So what did I say? You just need to do what? Create an expression of interest profile. That's what you need to do. It doesn't cost any money. Create an expression of interest profile and then take it from there. You submit it and then you wait for them. So, how do you create this profile? I read it down. So an international healthcare worker submission is not an application to SINP. Like I said, you can just drop it here and go. It is a pre-application form which allows you to fill out an online form to indicate your interest in working in Saskatchewan in a selected healthcare opportunity and show your qualification. So this is how you can just start, how to start planning yourself. You just go to online, fill the form, and then you go and you keep praying. Okay. You say those who have skills needed will be contacted with job posting information, identifying where and how to apply for a job opportunity. If you're selected and receive an employment letter, you may be eligible for the International Skilled Worker Employment Offer. It is the Saskatchewan International provincial nominee, all right, or hand to fill skills spots. Not all candidates who submit an EOI will receive a job opportunity notification. There are no limits on the number of workers who can submit. There are no limits. However, candidates can only have one profile. All right. So how do I create my profile? Let's go straight to how you can create your profile. And before we go to that, how do I create my profile? I want to show you the job titles, those people that are needed. Like I told you, everybody in the health sector. Okay, if you are working around the hospital and things around hospital health. The International Healthcare Workers EOI system is open to the following health sector occupations. All right, who are those? Now you have, this is the number, your NOC number. Health Information Management Practitioner, Public and Environmental Health and Safety Professionals, Occupational Health and Safety Specialists, this one I read, Registered Nurse and Registered Psychiatric Nurse, I'm coming, chiropractors, kinesiologists, and other professional occupations in therapy and assessment. So those who do kinesiology, people always look to, I know those who study kinesiology in school, people laugh at them. So what are you going to do with that? You can see. Nurse practitioner, physician assistants. Hello, physician assistants. Ndị na-enyere ndị doctor aka, all those aid doctors, midwives and allied health professionals. All those health professionals that work around. You see pharmacists, audiologists and speech language pathologists, physiotherapists, respiratory therapists, clinical perfusionists and cardiopulmonary technologists, other technical occupations in therapy and assessment, occupational therapists, medical lab technologists. So if you studied medical lab tech, you can see, you too, you can just go and drop your profile. Tomorrow you may be sleeping, you wake up and receive email, you'll be surprised. Medical radiation technologists, medical sonographers, cardiology technologists, and electrophysiological diagnostic technologists, pharmacy technicians, other medical technologists and their technicians, other medical technologists, because they can't name everything. That's why I'm telling you, if you're working around the hospital, you may fall into all these categories, okay? And then you have dental technologists, dental assistants and dental licensed practical nurses, paramedical occupations, other assisting occupations in support of health services. You see why I told you that everybody nwere ihe na-arụ n'ụlọ ọgwụ. If you have any job you are doing around the hospital, see, you can be covered here. Other assisting occupations in support of health services. All right. Now let's also go down. Nurse aides. Who are nurse aides? Those people are in Abondi, nurse Eliza. You are not the main nurse, but they are narrow assistant nurse. See it here. Nurse aides, orderlies, and patient associates. Your own is in the hospital. You help the patients. You help them lift them up. You help them to put down their legs. All those little people that work in the hospital and render these small services. Okay. For that another higher, see, you can use it. This thing can lead you to travel to Canada. Psychologists, therapists in counseling and related to specialized therapies. It say, please note there may be an English language requirement if your job offer is in a regulated occupation. It means that not all of these job offers will require you to go and write those exams. I'm very sure that all these small ones, nurse aides, orderlies, they may not require it. But if you are those ones that are highly, you may be required to write exams. So can still tell you can go to Canada without writing Ielt. Okay, so that is the job occupation. So they say, how do you create your profile? Like I said, you just create this profile, drop it, and keep praying as you also continue to plan yourself. All right. So this is how to create the profile. You have to click on it, and then it will take you to this PDF, and then you will please, you can do that. Just create. So that is, I have brought your way information that will help you if you are someone working in the healthcare and they look down on you. Especially, I want to give hope to those people they look down on and say, because they go on nursing, Igbo nurse, quack nurse, or just those people that are help around in the hospital. You can see that you too can go to Canada. And with job offer, you remember we said there, when you just fill the online form, all you need to do is to fill form and wait. If they will be the one to check your qualification and then get you those who are offering jobs, where there are job offers, they will connect you, then you will do what? Submit. So it's not as if you're the one to go about stressing yourself looking for job. No, you just submit, fill this form, go to this website that I just showed you. All right. You go there and then you create your profile, and then you go about your business. You keep praying. One day they'll just tell you, okay, come and apply to this place. And if they are the ones that recommend you to apply to so and so place, you sure that they have checked your profile and they know that you fit into that category. And so you apply and you may be on your way to Canada. And when it matures, so my people, today this is the information I just want to share with you. As I said earlier, if you are not following me, please follow me, because the time will come. If I drop a message, maybe in 2 or 3 days, it will expire. Please, like I keep telling people, the first step, what you can and will advise you, this money you use now, the first step you will do, the money you use now, you celebrate. Save money as you are celebrating. Save money and go and do your passports. Do your international, because all these ones now, even if you have your passport, you don't need to have your passport to create this profile, right? But create it, have your passport, because it takes time to process passports. So if you have the job offer that comes and it's going to expire in 1 month, and you are given the job, you're asked to apply and you get the job and you're supposed to go and receive it, and you don't have a passport, you can see that you have just lost the opportunity. So first of all, get your international passport ready. International passports, the minimum it can last is 5 years. So you keep planning yourself and keep praying. And I'm praying for you that your dream will come to pass. I wish you all the best. Stay tuned to this channel. Don't forget to share the video, like, and also drop your comments in the comment section. All right, I'll see you again in my next video. Ciao, ciao, ciao.